Friends, today me and Rishi, we both are going to give some dialogue on regenerative medicine. What is regenerative medicine? How I entered in this field? It's a long story. And Rishi, my son, who is an entrepreneur, who was for 8 to 10 years outside doing his education, was observing from far away this potential therapy. Being in the US, he came to know many more things than what they were available in India. And when he came back, he realized what a fascinating branch this is. The results of few patients which he saw with me, India's first stem cell baby and world's first at the age of 45. And he realized the tremendous potential, and we got alive wellness therapy. Let's hear from Rishi some aspect of what is this alive wellness therapy.
So as of now, Alive is something that has been there for the last 3-4 years. But when it actually started, it started with the disease of kidney failure in my own grandmother, in mom's mother.
That's interesting. Can I say
Yeah.
that about?
Yeah, let's talk about
Because as a gynecologist, friends, I don't think I had a knowledge about this regenerative medicine or a stem cells too much. Forget about just the knowledge, the application of it. 2015 August, my mother suddenly became breathless. She was obese, 90 kg, with diabetes of 30 years and the blood pressure of another 20 years. I thought her breathlessness, her gasping for oxygen, heart rate to 170, the blood pressure falling, I felt it is a cardiac failure. I rushed her to Ruby Hall. And when we got the reports in hand, by the time my intensivist all settled her, we came to know her heart is fantastic. There's nothing wrong. It is just because of the diabetes. We all know the diabetes affects all end organs. May it be heart, maybe kidney, maybe liver, maybe pancreas, everything comes into the way, including your nerves, the sensations in the peripheral system, which already she had a low sensation or decreased sensation in her legs, and we were always very cautious about not to have any foot injury or what. Now, when we found out that her kidneys have failed, the biggest thing was needing a dialysis. What do kidney do in a body? It removes the toxins. If the kidneys are not working, the toxins are getting collaborated, they will affect the brain and everything. Now, she was very firm that she don't want dialysis in her lifetime. She was 75, not fit for a kidney transplant also. So the thought came, why not to regenerate her kidney? And I started finding any centers in the country where I can take her and do the stem cell therapy. To my surprise, I found no centers in India is doing kidney regeneration. Now, we all know how emotional we are when it is our mom. I hope so, Rishi, you are equally emotional about me. But I want my mom to live as long as I'm living. That's what the Indian culture is. And I was working and trying to find out, and I found one scientist who said, ma'am, I know everything. You don't have to shift her to Delhi or Bombay because they don't have a center. I can start a center for you. And that's where I started my first solo stem cell unit, where on, I don't say, remember the date, but it was Datta Jayanti in
December 2015.
2015. It was a Datta Jayanti of 2015. So from August to December, what I did was build up state-of-art stem cell therapy unit. That time, there were a lot of restrictions by the government, by the ICMR, But I just wanted to do something for my mom and my scientist as he promised. He came down and I realized it's a very simple technology to take out the bone marrow, process the stem cells and put it back. For a diabetes or a kidney, we put it back through the IV therapy as against the joints and the neurological. So what I found was in 6 months, my mom was 90% of her medicines, that is insulins, which was surprising. I did not do it for a control of diabetes. I did that for regeneration of her kidneys, and she was allowed 1000 ml of fluid intake, any form, water, coconut water, tea, coffee. The output has to be 1000.
And another thing to add here is this was done for her at the age of 74. She was
74,
74 at
75.
the time, and in hindsight now, it's been 9 years almost since we're talking as of today, but we delayed her dialysis by 5 years.
6
She
years.
was 6 years. She was scheduled, and the doctors had said in the next 3 to 6 months she will need it. But in hindsight, we could pull it along for at least 5 years.
Yeah. So what was most important for us was getting my mom live a life without insulin, without undergoing dialysis or anything, having strict input and strict output chart maintenance. And she was so happy she could see so many things in life. But during those period, we studied the stem cells a lot.
And this result, we focused on our kidneys, but then, like ma'am said,
Yeah.
we got the benefit for diabetes, right? Her insulin requirement went down. To the extent that we had to make her eat a little bit more and then give her insulin so that it stabilized, because she was 74. Her blood sugars were very up and down. But insulin requirement went down, medication requirement went down, and we realized that this has a very big impact for all your organs. Her swelling had gone down, she was feeling more fresh, her skin was glowing, skin tightening.
Because what happens, the stem cells, they have a capacity to go and form any cells. All our body cells are made up of stem cells. And these stem cells then start regenerating once they are in your system. The kidneys, the heart, the pancreas, the liver, the skin, the lymphatic tissue. The most important is new blood vessels, neoangiogenesis. So we have been, when we realize it's not only the infertility or diabetes, if you are in early stages of joint pain, arthritis, our orthopedician team, Dr. Naik joined us. In stage 1, 2 arthritis, when there is a cartilage enough to reproduce that cartilage in a larger way, we started doing. My own father-in-law, we did stem cell therapy twice for his knee joint.
So, stem cells we did for her, we delayed her dialysis, and we also saw the impact in her diabetes. And then we realized that, this is something amazing and we need to explore it further. She was the first patient. There was no trial, error, testing, nothing, because these are your own cells put back into you. There are no side effects. The worst case scenario we say is no benefit. But the best case scenario, like in her case, was delaying her dialysis, bringing down her blood sugar levels, improving her pancreatic function. A lot of these things happen.
Improving her life, her locomotor system, her walking, which she was obese with the edema and everything. It was difficult for her to walk. She started doing 2 kilometers walk per day.
Yeah.
So it improved everything for her.
So at that time, first let me explain what these stem cells really are. For example, you get a slight cut on your skin, right? So your skin automatically knows that in that same spot, same size, same shape, same color, it has to regrow. That intelligence to do it comes from the localized skin stem cells. Similarly, across our full body, there are organ-specific stem cells. And in the bone marrow and in the fat, there are these master cells. Everything in your body is constantly communicating with each other. So the bone marrow is supposed to be signaled whenever the localized cells are not functioning well. Bone marrow stem cells are supposed to go, regenerate, become those localized cells, which then function for a long enough time. At this point of time, when we were just understanding the science, we were getting all our scientists on board. We have the scientists from Manipal Regenerative Institute on board, DY Patil Regenerative Institute on board. We were understanding these
We
processes, how
also
they work.
have the physician, the
Of course,
orthopedician,
the
the
doctor fraternities there. We have a cancer person, we have a ENT, we have a physician, we have orthopedics. A lot of doctors on board, but the scientists at the time knew the knowledge and the doctors didn't have the knowledge. But doctors had patients, scientists didn't have patients. So we brought
Let me tell you,
everybody
even
together.
today, not all doctors have a knowledge about
Correct.
regenerative medicine. If it would not have been my mom, I don't think I would have got so much knowledge.
Correct.
I would have not entered in the field being so busy in my own OBGYN practice.
Yeah. So we thought, okay, let's see what other applications are there. We started exploring applications for osteoarthritis, for Parkinson's, for stroke-induced paralysis, for autism, cerebral palsy, lot of neurological stuff, lot of lifestyle stuff, lot of degenerative conditions. Sometimes there are things which are coded into our genes, but until there is a trigger, it doesn't come alive. Suddenly, one day people get autoimmune diseases. Why? Because there is something that has triggered them to happen. So all these conditions were there, 40, 50 different conditions were there. We studied a lot of them. And then
We narrowed down to-
over the span of 2015, 16, 17, 18, we started narrowing things down into what is getting great results. And we got really good results for my own grandfather as well. He was 76 at the time, was supposed to be admitted for both knee replacement. And a little bit of sugar, old age, not sure whether he's going to survive that surgery. So we found a conservative application. Okay, let's inject his own stem cells into his knee joints, also into his bloodstream, let them rejuvenate. And 9 years later, we lost him about 1 month ago. But for 9 years, he did not need knee transplant. Is this possible for everybody? No. Now, based on our
We
research,
call knee replacement.
knee replacement. And is this possible for everybody? No. We don't advise you to come to us when you're super late stage, because at that time you might gain more from the replacement than you will from stem cells, because these stem cells don't know how to go create something new. They will regenerate what is there. But so if you have stage 1 arthritis, stage 2 arthritis, great results. Early stage Parkinson's, great results. Diabetes has started setting in. Why wait till your organs start failing? Adopt these things into your lifestyle, and that is
Can
what
I
we sort
say
of push for.
something? When we do for the diabetes, people, what do they expect? They expect they are taking insulin, it should stop off. No. Diabetes is a progressive disease which kills your every organ slowly. Because the blood vessels, the nerves, the organs,
And
everything is affected.
Yeah.
Now, these stem cells causes neoangiogenesis. So your sugar, I don't know, it depends upon how your pancreas got regenerated, your insulin requirement will be. But what is important is your other organs are getting peripheral circulation, collateral circulation, new vessels are coming, even if the old vessels are getting blocked. So the function of the organ or the damage of the organ will be delayed for a long. They should expect.
Let's explain how diabetes also works. The way diabetes normally works, it is, मतलब sugar rise हो गया is an accepted thing कि अभी sugar has increased. Okay, I will start medication. Then after some time the medication will be not enough. Then insulin production नहीं है body में, तो insulin भी देना पड़ता है. Then after some time your pancreas will really start dying out. So insulin also, how much will you take? When that level sort of comes in, then the blood sugar levels are very high, and then organs start getting affected. But this organ failure that happens maybe at 60, 70, 80 has started at 30, 40, 50, depending on what your sugar levels are. For someone it can be kidneys, for someone it can be eyesight, for someone it can be heart, for someone it can be neurological things. So first thing is to arrest the degeneration of your organs, which is happening because of high blood sugar levels. And just like your skin stem cells know कि इधर का skin regrow करना है, your master cells also know how to identify the damage in the body and go start regenerating that. So they will start regenerating the pancreas. So when you regenerate the pancreas, you are increasing the capacity of the beta cells in the pancreas. You're regenerating the beta cells in the pancreas, which will essentially produce more insulin. And that is how you address the root cause. मेडिकेशन लेना इज शुगर को कम करना, इंसुलिन लेना मीनिंग बॉडी में इंसुलिन नहीं है इसलिए इंसुलिन लो. बट इन ऑल ऑफ दिस प्रोसेस वी आर नॉट एड्रेसिंग द फंडामेंटल डिजीज. The stem cells and regenerative medicine goes and addresses that fundamental disease. And with root cause application, people can live longer, healthier lives. We call it health span. Lifespan is increasing. People are living to 80s, 90s, 100s. But in those last 10, 15 years, are you really healthy? Are you enjoying living that last 10 years of your life? That is what is health span. And stem cells has the potential of doing that specifically for diabetes and for multiple other diseases as well.
Shall we also say, you know what happened? When we did a couple of our close patients and for infertility, we got the permissions as well. What was important we realized is when stem cells are given, even to a lady, I have started stem cell for myself. Now, am I having blood pressure, diabetes, or anything? No. What I realized is as I'm aging, every day my cells, my organs are aging. Can I regenerate these organs even when I'm healthy? That is called reversal. Now I'm 60. When I was 30, I was working 20 hours. When I was 50, I was working 20 hours. And even today, I work 20 hours with equal energy. Because after my mother's experience and after studying stem cells for a long, what I realize is if I take out my own bone marrow, process it and put it back, it altogether take me 2-3 hours. No anesthesia, no admission. Why not to regenerate my own body, my own organs? And that has improved, or that never allowed to deteriorate my stamina, my energy. I have no glasses, I don't wear the lenses, you can check, but I do feel that the stem cells are working, they are regenerating my organs. So after my mom, I think 2016, many of us, the family, the close family, the relatives, we all do the stem cells for anti-aging. We do one in the month of October or end of September and the second by end of November. Only COVID pandemic year, the 2021, I did not do the stem cells. So I just did stem cell 9 days ago on Sunday and I'm repeating again in December. I found it's not for my skin, it's not for my outside look. I may be 60 chronological age, but my organs, they may be 5 years, 7 years, 8 years back, my stem cells will take. What I realized is for my husband, Dr. Rajesh, I take out the stem cells. When we did first 1-2 sitting, with very much difficulty, I was pulling out 100 cc. And I told him, it's not my capacity of not pulling from the bone, but I don't see your bone marrow is producing so much. And in subsequent sitting, the 200 cc last month when I did for him, 200 cc of bone marrow just kept on coming. Where my technician after 200 cc, she said, ma'am, you can stop now. Am I worried that I'm taking out too much? No. It's like how your blood, you have a 5 liters of blood, you donate today the blood, within no time the blood is reproduced. From where? It is from the bone marrow.
In fact, in this, what the conclusion to this was bone marrow and the stem cells have not just helped regenerate the internal organs, it has also helped regenerate the quantity and quality of stem cells that are there.
Yes.
Eventually, with age, our cutoff for these therapies is 75 years because after that, the quality and quantity starts dying down. But until then...
Yesterday, a 77-year-old lady, my patient's mother, she's otherwise quite active, good, not having any disease. And she said, can you do for my mom? Yeah. Now, of course I can do. The lady understands that for anything 75 or above, we believe that the stem cells, I may not get enough quality, I may not be offering, but if someone very close family friend wants to do it for her mother, just for aging, wonderful. Even if she would have got diabetes, I would have still done because she understands what are stem cells, what results they should expect out of it.
And stem cells and regenerative medicine is a vast subject. And
You always say, right? When he came and he wanted that IV therapies, and when he was explaining me about the NAD and many other things, I was so surprised because he is not a doctor. He's a huge talent I have with me. I'm blessed. But his knowledge about the subject was more than me or my any colleagues, any physician. You ask anyone, they will say, no, 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 it's not. Because it's like how allopathy people will not have a knowledge about homeopathy. Homeopathy don't have about allopathy. Same is regenerative medicine.
it's a different vertical
Yeah.
altogether.
So probably our allopathy doctor friend should say, oh, probably I don't know. I'm not the right person to ask. Just say when they ask me, can I take Ayurveda for increasing the egg reserve? I said, listen, my knowledge in Ayurveda is zero. So I don't know. Just ensure whoever you are taking the medicine, check it after 3 months.
And it eventually it will, there are a lot of things. It's not just stem cells or just allopathy or just people. Some people have some things working for them, some people don't. In the long run, when aging is getting accelerated, regenerative medicine and stem cells is the future.